Coronavirus symptoms. What is coronavirus? The facts 2020. Hi guys, welcome to Healthy Bodies. We provide daily videos on a wide range of health topics, so please hit that subscribe button and turn on notifications. That way you will never miss any of our updates. In today's video we explain what coronavirus is and review the symptoms. The recent coronavirus outbreak is known as novel coronavirus. Coronaviruses are a large family of viruses that are known to cause illness ranging from the common cold to more severe diseases such as pneumonia, severe acute respiratory syndrome, kidney failure and even death. The virus broke out recently in China and is a relation to the well-publicised previous virus strains, Middle East Respiratory Syndrome, known as MERS, and Severe Acute Respiratory Syndrome, known as SARS. Novel coronavirus first spread to humans from an animal, believed to be a snake, in Wuhan, China. SARS is believed to have been transmitted from cats to humans in China back in 2002, and MERS from dromedary camels to humans back in Saudi Arabia in 2012. On the 30th of January 2020, the World Health Organization declared the outbreak to be a public health emergency of international concern. As at this date, 9,826 confirmed cases have been reported globally, with the majority in China and 106 cases across 19 other countries. In China, a further 15,328 cases are suspected and there has been 213 reported deaths thus far. So what are the facts? Symptoms. It really depends on the virus, but common signs include a runny nose, respiratory symptoms, sore throat, fever, cough, shortness of breath and breathing difficulties. In more severe cases, especially in the young and old, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure and even death. How does it spread? The virus can be passed on from person to person when exposed to the infected person's bodily secretions, usually after close contact. Therefore, a sneeze, cough or handshake could cause exposure, as can touching infected objects. Can it be treated? When a disease is new, such as this one, there is no vaccine until one is developed. It can take a number of years for a new vaccine to be developed, so currently there is no specific treatment or cure for the virus. However, many of the symptoms can be treated and doctors can relieve symptoms by prescribing pain or fever medications. How can you prevent it? There are several steps you can take to help reduce the likelihood of novel coronavirus infection. Frequently clean your hands by using alcohol-based hand cleanser or wash with soap and water. Ensure you disinfect any surfaces you touch. When coughing and sneezing, cover your mouth and nose with flexed elbow or tissue and immediately throw away any tissues used and wash your hands. Try and avoid close contact with anyone who has a fever and cough. If you have a fever, cough and difficulty breathing, you should seek medical attention at the earliest opportunity and share previous travel history where appropriate. The consumption of raw or undercooked animal products should be avoided. Raw meat, animal organs, milk should be handled with care to avoid cross-contamination with uncooked foods. When visiting live markets in areas currently experiencing cases of novel coronavirus, avoid direct unprotected contact with live animals and surfaces in contact with any animals. Many countries are now screening people who may be at risk of being exposed to the virus, especially those having travelled through high-risk geographic areas. Quarantine restrictions are being imposed where appropriate. The situation is fluid and fast-moving, so please refer to your local in-country health service provider for the latest advice and guidance specific to your particular area. We hope you found this video useful. We have many similar videos being released shortly. So please hit that subscribe button and turn on notifications. and that way you will catch all the latest updates. Until next time, goodbye.